Did you know that in just 6 months, a small prostate tumor can quietly spread to the bone? Or that a seemingly harmless mole on your arm is the first sign of malignant skin cancer? The scariest thing about cancer is not when it clearly appears, but the days, weeks, even months it silently exists in the body of the elderly without causing any obvious pain. And that is why many cases of skin and prostate cancer in the elderly are only discovered at a late stage, when the disease has metastasized, when the treatment opportunity has significantly narrowed. But the good news is, we can completely recognize the early signs of these two common cancers. With the right understanding and a little careful observation, you, or your elderly loved one, can detect the disease before it causes serious consequences. In today's video, we'll share 5 simple yet powerful ways to detect skin cancer and prostate cancer early. 2 diseases that are silently threatening the health of millions of seniors in the United States. Watch this video until the end, because if you know just one sign, you can save yourself or a loved one from a long and painful treatment journey. Start now. Part 1. Early detection of skin cancer in seniors. Small changes that can save lives. Skin cancer is one of the most common cancers in seniors in the United States, and the worrying thing is that it is often overlooked in its early stages. After decades of sun exposure, without adequate sunscreen or proper protection, senior skin becomes thinner, weaker, and more vulnerable to cancer-causing factors. The danger is that skin cancer is not always painful, not always fast-growing, and not always in visible places. Many people think that a dark spot on the skin, an old mole, or a sore that won't heal is just normal aging. But in fact, it could be the first sign of skin cancer, a disease that, if not caught early, can spread to the liver, lungs, or bones. There are 3 main types of skin cancer that seniors should know about: basal cell carcinoma, squamous cell carcinoma, and melanoma. Melanoma is the most dangerous because it can grow quickly and spread if not treated early. However, all of these types can be detected if seniors, or caregivers, pay attention to the early warning signs. An important tool in self-monitoring your skin is the ABCD rule. A is for asymmetry. A benign mole is usually symmetrical. If you draw an imaginary line dividing it in half, the 2 sides should be almost identical. If it is not symmetrical, be wary. B is for border. The edges of a malignant mole are often jagged, blurred, jagged, and uneven. C is for color. A normal mole is a uniform color, while an abnormal mole can vary in colors such as brown, black, red, or blue. D is for diameter. A mole larger than 6 millimeters in diameter, about the size of a pencil eraser, should be checked by a doctor. E is for evolving. Any change in shape, size, color, or sensation such as itching, bleeding, or peeling is cause for alarm. In addition to unusual moles, older adults should also watch for sores that don't heal after 3 to 4 weeks, areas of thickened, scaly skin, or white or pale pink patches that develop in areas that are often exposed to the sun, such as the face, ears, neck, arms, and backs of the hands. In the United States, many older adults live alone or are no longer able to perform a comprehensive physical examination. That's why caregivers, whether family members or healthcare workers, should help older adults regularly check hard-to-see areas of the skin, such as the back, neck, scalp, behind the ears, and soles of the feet. In particular, people with a history of severe sunburn, fair skin, light hair, or a family member with skin cancer should be checked more often. The American Cancer Society recommends that people age 60 and older get a skin exam with a dermatologist at least once a year. For those who have had a precancerous lesion or are monitoring a suspicious mole, the follow-up visit may be shorter. Detecting skin cancer early doesn't require fancy equipment or complicated procedures. Sometimes all it takes is a large mirror, good lighting, and a little careful observation each month. The important thing is not to ignore small changes. An unusual dark spot may be the only thing that alerts you to a major problem. Remember, early detection is your best chance for a cure. And with skin cancer, it can mean the difference between a simple procedure and a long treatment journey. Part 2. Early detection of prostate cancer in the elderly. Silent signs that should not be ignored. Prostate cancer is the second most common cancer in men in the United States. especially in people over 65 years old. It is worth noting that this disease often develops silently, does not cause obvious symptoms in the early stages, and is easily confused with common urinary disorders due to old age or benign prostatic hyperplasia. However, early detection of prostate cancer can help control the disease effectively, avoiding metastasis to the bones, a common and extremely painful complication if the disease progresses without timely treatment. The first thing to remember is, the prostate is a small gland located below the bladder, surrounding the urethra. When there is an abnormality here, whether benign or malignant, it can also affect the urinary tract. Some early symptoms that older men should pay special attention to include difficulty urinating or a weak, intermittent stream, feeling like you haven't finished urinating or needing to urinate many times a day, especially at night, difficulty controlling the flow of urine, sometimes accompanied by a burning sensation when urinating, blood in the urine or semen, pain in the lower back, hips, or thighs. This can be a warning sign that the cancer has spread beyond the prostate. The problem is that many older men have become accustomed to the inconvenience of urination and think it's a normal part of aging. Even when blood appears in the urine, they hesitate to go to the doctor because they're embarrassed or afraid of finding out they have a serious illness. That's why so many cases of prostate cancer are diagnosed at a late stage, when the cancer cells have escaped the gland, spread to the bones or other organs, making treatment much more complicated and expensive. In the United States, the two most common methods for early detection of prostate cancer are the prostate-specific antigen, PSA, blood test, and the digital rectal exam, DRE. The PSA test measures the level of prostate-specific antigen in the blood. If abnormally high, it can be a sign of cancer or other prostate diseases. However, PSA is not always absolutely accurate, so it is often combined with DRE to increase reliability. In recent years, more modern methods, such as prostate MRI and guided biopsy, have increased the ability to detect small tumors before they spread. The American Cancer Society recommends that men age 50 and older begin discussing prostate cancer screening with their doctors, and for those at high risk, such as those who are Black or have a father or brother with prostate cancer, starting at age 45. Annual screenings or as directed by your doctor are important, not only because they can detect the disease early, but also because they can assess how quickly the tumors are growing, and then decide whether to treat or monitor them closely. For older men, the decision to treat prostate cancer sometimes depends on life expectancy, underlying medical conditions, and quality of life. But whether or not to treat, early detection is crucial because it gives patients and their families the choice to be proactive, rather than reactive, before the disease becomes uncontrollable. Prostate cancer may not be painful in its early stages, but if left unchecked, it can lead to complications, pain, and dependence in the later years of life. Don't wait until symptoms become apparent. Ask your doctor about your PSA, get regular checkups, and carefully monitor any changes in urination. It could be the first step in saving your life or the life of a loved one. Part 3. Combining medical monitoring and self-observation. Strategies for early detection of skin and prostate cancer in older adults. Early cancer detection in older adults is not just about going to the doctor when there are unusual signs. It is a process that closely combines two factors: the initiative of the patient and caregiver, along with a scientific and regular medical monitoring system. In the United States, where the healthcare system has many options, making good use of available tools can help older adults detect skin and prostate cancer at a very early stage, when the disease is still completely controllable. First, let's talk about the importance of regular checkups. Major health organizations such as the CDC, the American Cancer Society, ACS, and the USPSTF all recommend that older adults be screened for prostate cancer and skin cancer on a regular basis. For prostate cancer, the PSA, prostate-specific antigen, test is the primary tool. While the PSA does not always accurately reflect the severity of the disease, when performed regularly, it can help detect small changes over time. From there, the doctor can order a prostate MRI or biopsy if necessary. However, in the United States, many older adults tend to delay screening for psychological reasons: fear of the results, fear of biopsy, reluctance to go to the hospital, or simply lack of information. This is where the role of relatives or caregivers becomes important. If you are caring for a parent, grandparent, or senior, don't wait for them to say, "I'm not feeling well," before you schedule an appointment. Be proactive in encouraging them to get regular checkups, helping them understand that this is a way to maintain independence and quality of life, not to find a disease. With skin cancer, self-observation is also key. A survey by the American Academy of Dermatology found that nearly 60% of melanoma cases in people over 65 were discovered by the person or a loved one who noticed an unusual spot. So make it a habit to do a full-body skin check every month. Older adults can ask a loved one to help them check hard-to-see areas like the back, scalp, or bottom of the feet. Placing a large mirror in the bathroom, using bright lighting, and taking notes or photos of suspicious spots to compare over time are simple but effective tips. Another important factor is understanding and monitoring your personal risk factors. People with a history of sun exposure, outdoor occupations, fair skin, light hair, or a family history of skin cancer should monitor their skin more closely than usual. Similarly, if a family member has had prostate cancer, or if the patient is black, a group at higher risk of developing and dying from prostate cancer, screening should begin earlier, around age 45, rather than age 50. That many older people have the misconception that when you are old, you don't need to see a doctor anymore, or live as long as you can. However, it is during old age that the body needs more careful care than ever. Early detection not only helps prolong life, but more importantly, it helps the elderly maintain their initiative, not depend on others, and continue to live a meaningful life with their children and grandchildren. Finally, remember that the coordination between the patient, the caregiver, and the doctor is the golden triangle in early detection and control of cancer. No one can do it alone. When the elderly are monitored regularly, actively observe small changes, and have the right guidance from medical professionals, the chances of surviving, or even completely recovering, from skin or prostate cancer are much higher. Part 4. Common mistakes that cause cancer in the elderly to be missed until it has metastasized. Each year, tens of thousands of older Americans are diagnosed with skin cancer or prostate cancer at a late stage. Unfortunately, many of these cases could have been detected early if they had not made common mistakes, misconceptions, or unintentional negligence that have allowed the disease to develop silently until it has metastasized. Understanding these mistakes is the first step in protecting yourself and your elderly loved ones from unfortunate consequences. The first mistake is to ignore minor symptoms. For older people, many signs of cancer, such as difficulty urinating, mild fatigue, skin changes, are easily attributed to normal aging. A dark spot on the hand is thought to be age spots. A frequent nighttime urination is thought to be due to drinking too much water. A patch of peeling skin is thought to be dry skin. But cancer, especially skin and prostate cancer, often starts with very small changes. And if you ignore them, you may miss your best chance for treatment. The second mistake is not regularly checking for areas of skin that are often overlooked. Melanoma, the most dangerous type of skin cancer, can appear on the back, under the fingernails, on the soles of the feet, or behind the ears. These areas are often overlooked during routine checkups. Older people who live alone or have limited mobility may have a harder time self-monitoring. This is where the role of caregivers becomes essential. A few minutes of skin examination each month can make a big difference. The third mistake is putting off seeing a doctor out of fear or embarrassment. Many older people worry when they hear the word cancer, so they choose to ignore any unusual signs in their bodies. Some even refuse to have a PSA test or prostate biopsy because they are afraid of complications or the impact on their personal lives. This delay allows the disease to progress silently. In fact, many prostate tumors that are detected early do not require immediate treatment, just close monitoring. But if you wait until there are obvious symptoms, such as blood in the urine or bone pain, the disease has already entered a dangerous stage. The fourth mistake is the lack of coordination between caregivers and the health system. In the U.S., there are many health programs that support seniors with regular cancer screening, from Medicare to community clinics. But if caregivers do not take the initiative to take their seniors for checkups, or do not know the appropriate screening schedule for their age, the opportunity for early detection will be missed. Sometimes, just because no one reminds them or schedules them, seniors can skip PSA tests or regular skin exams for years. The final mistake is believing that early detection does not change the outcome. Many seniors have said, "Cancer is the same. What difference does it make to know sooner or later?" This is a dangerous misconception. The difference between detecting skin cancer early, when local excision is sufficient, and metastatic, when chemotherapy, immunotherapy, or extensive surgery are needed, is huge in terms of cost, pain, and survival. With prostate cancer, early detection can even help patients live a normal life without immediate treatment. Seizing the opportunity early means taking control of your own life. Identifying these mistakes is not to create fear, but to help each senior and their caregivers act smarter more promptly. A change in thinking, a closer look, an earlier appointment can change the course of the disease. And sometimes it can save a life. Part 5. 5 monthly habits that help seniors detect cancer early. Small actions, big opportunities. When it comes to dealing with cancer, especially in seniors, nothing is more important than early detection. However, early detection does not necessarily depend entirely on modern medical equipment or intensive examinations. In fact, many cases of skin and prostate cancer have been detected thanks to very simple actions, from the habit of self-observation, writing, to paying attention to small changes in the body. Here are 5 monthly habits that any senior or caregiver can do to improve the ability to detect the disease early, before it becomes a real danger. 1. Do a full-body skin self-exam in front of a mirror every month. Spend about 10 to 15 minutes each month, preferably on a fixed day, for example, the first of the month, to observe the entire body in the mirror. Look for unusual moles, skin spots, or discoloration. Use the ABCD rule from earlier. Asymmetry, border, color, diameter, evolving. Don't forget to check hard-to-see areas like your back, underarms, scalp. Use a hand mirror, soles of your feet, and fingernails. Caregivers should help with hard-to-see areas. 2. Monitor your bladder and sexual health. Prostate cancer is often painless at first, but it can show up in a very obvious change in your bladder habits. Ask yourself each month, is it harder to urinate? Do I get up at night to urinate? Do I feel like I can't empty my bladder completely? Also, pay attention to pelvic pain, blood in your urine or semen, or difficulty getting an erection. All of these can be signs of a prostate problem. Don't hesitate to make notes or ask your doctor at your next checkup. 3. Keep a simple health diary. A small notebook or phone app can help you record noticeable changes over time. Each month, an older adult or caregiver should write down weight, fatigue, non-healing wounds, skin changes, urinary symptoms, or any other unexplained symptoms. When you bring this diary to your doctor, it can help your doctor spot unusual trends that you might not notice yourself. 4. Set reminders for regular checkups. One of the reasons for delayed detection is forgetting to schedule a checkup. Use a phone calendar or a note on your refrigerator to remind you of screenings. A prostate PSA test should be done annually starting at age 50, or earlier if you're at high risk. A skin check with a dermatologist once a year, or more often if you have a history of skin cancer. Don't just wait for the doctor to call. Be proactive in scheduling appointments for yourself or your loved ones. 5. Talk about health. Don't avoid it. Don't take it lightly. An important but often overlooked habit is communication. Older adults should talk regularly with their loved ones or caregivers about their health. Is there anything unusual? Is there anything they are concerned about? Open sharing will help caregivers provide timely support. Many older adults have symptoms, but hide them for fear of disturbing them or being shy to talk about it, and that can cause the disease to progress silently. Sometimes, a simple conversation can save a life. Remember, no one knows your body better than you, and no one takes better care of your loved ones than your own family. The above habits don't cost money, don't take much time, but if maintained regularly every month, they can help you detect diseases early, control the situation, and most importantly, protect life. Cancer is not a death sentence, especially when it is detected early. For older adults, proactively monitoring your health, Observing small changes in your body and staying connected to your healthcare system can not only help detect cancer early, but also improve your quality of life. In this video, we explore 5 practical strategies, from monthly skin self-exams, monitoring for unusual urination, keeping a health diary, setting up regular screening reminders, and encouraging open communication within the family. These seemingly simple actions, if maintained regularly, can make a big difference, detecting cancer when it is easier to treat, when the patient is still healthy and able to recover. Don't let the disease progress silently because of a little lack of observation or because of reluctance to seek medical attention. You or your loved one deserves the chance to fight the disease early, with hope, with choice, and with time. If you find the information in this video useful, please share it with your friends and family, especially those who are caring for parents and grandparents. Let this knowledge become action, and action become life opportunities. Subscribe to the channel so you don't miss important health content for seniors.